O pnawn da, unwaith eto, thank you for joining me once again as we report on the latest 3-week review of the coronavirus regulations. I'm going to start, as usual, by dealing with the public health situation, beginning with the current circumstances here in Wales, and then focusing on the so-called India variant of concern, or as the World Health Organization has renamed it, the Delta variant. So here in Wales today, the 7-day case rate continues to be very low. We have fewer than 10 cases per 100,000 people, and the positivity rate is also low at less than 1%. I'm very glad to be able to confirm that the number of deaths is also very low. There have been no new recorded deaths by Public Health Wales in the last 9 days. And that is very good news. But there's no doubt the coronavirus does still go on, claiming lives. And my thoughts are, as ever, with all those families who have lost a loved one during this terrible pandemic. Because we have such low rates in the community, we also have the lowest number of people in hospital in Wales suffering from coronavirus since the start of the pandemic. But this certainly does not mean that the health service in Wales isn't very busy. It's extremely busy, responding to all the other health problems and the health emergencies people have, and in catching up on work that has had to be postponed during the pandemic. And our fantastic vaccination programme also continues to make rapid progress. Nearly 60% of all 18 to 29-year-olds in Wales have now had their first dose of the vaccine. And nearly 1.2 million people across Wales have completed the full 2-jab course. This really is an incredible effort, and thanks go to the hard work of those thousands of people across Wales in vaccination centres, in GP practices, in pharmacies, and those people behind the scenes who carry out the complicated job of planning how to get the vaccine to people in the right volume at the right time. Now, all of this is good news, but it is not the whole of the picture. And I now need to set out what we know about the Delta variant, that India variant of concern. Over the course of the last 15 months, this virus has been full of unpleasant surprises, and the emergence of this variant is yet another one. We have been carefully monitoring the new Delta variant as we see it spreading in many parts of England, despite the restrictions in place there. Today, there are more than 10,700 confirmed cases in England, largely linked to 8 areas of the country and mainly in the northwest. And beyond that, there are a further 1,500 cases in Scotland. Indeed, the Delta variant has quickly become the dominant form of the virus in new cases recorded in both Scotland and England. And if that pattern continues, it's important to say to everyone today that we will not be immune from that here in Wales. Already we have 97 identified cases in Wales, and we know that there will be more than that. Of those we know about, that 97 cases, everyone has been traced, advised to isolate, and their contacts have been contacted too. Now, this includes a large cluster of cases in Conwy in North Wales, and we keep that large cluster under very close investigation. Community testing is now available for anyone living in Llandudno Junction, Llandudno and in Penrhyn Bay. And I would ask anyone in those communities to come forward and to use those community testing facilities. So to summarise, while the public health position remains good in Wales today, the Delta variant adds a new level of uncertainty and complexity. And it has created the backdrop against which we have carried out the latest 3-week review of our own coronavirus regulations. The Cabinet's conclusion, based on the advice we have received, is that we have the headroom to move into Alert Level 1 as from Monday of next week. But we will do this in a phased way, focusing on relaxing restrictions around outdoor events and activities first, because the evidence suggests that the risk of infection is between 15 and 20 times lower outdoors than it is indoors. From Monday of next week, therefore, up to 30 people will be able to meet indoors, and that includes indoor hospitality, public spaces and private gardens. Outdoor events and organised activities will be able to take place with a maximum number of 4,000 people in a standing venue and 10,000 people when they are seated. But I must make this very clear, those are maximum numbers. All organisations arranging such events must carry out a risk assessment of the specific venue to make sure that it is meeting the requirements set out in regulations to take the measures necessary to prevent the spread of the virus. Now, over and above the easements that we can offer from Monday for activities outdoors, we will also be able, from Monday, to increase the number of households who can come together to form an extended household and support bubble. Up until now, only 2 households have been able to come together. From Monday, that number will increase to 3. And I know that that will be welcomed by many families right across Wales. Beyond Monday, the next set of decisions about relaxing restrictions around indoor events and activities will be made ahead of June the 21st. And that gives us 2 more weeks to make sure that we have the best possible information about the Delta variant. It will also give us 2 more weeks to go on focusing on our efforts on vaccinating people, because vaccination gives us the strongest defence against the virus. By June the 21st, we anticipate that a further 90,000 people will have received their first dose of the vaccine, and 180,000 more people will have completed the 2-dose course. Now, this will be a significant further defence against the virus here in Wales, and I hope to have more to say about the vaccination programme and our plans for completing the full vaccination of the adult population in Wales at my next press conference, which will be taking place here on Monday. So, for Monday of next week, we will take another step away from the restrictions we have all lived with for so long. But the Delta variant is a sharp reminder that the pandemic is not yet over and that coronavirus continues to be with us here in Wales. The best way we can protect ourselves from it is by keeping doing the things which have kept us all safe for so long and helped to bring the virus under control in Wales. And that means all the things with which everyone will be familiar. Keeping our distance from other people, washing our hands regularly, wearing a face covering in indoor public spaces, working from home wherever that is possible, and keeping indoor spaces as well ventilated as we can. And it also means saying yes to vaccination. All the evidence we have says that 2 doses does offer protection even against the new variant. And it's never too late to be vaccinated here in Wales. If you are not yet one of the millions of people to have had a vaccine, you can still arrange that appointment. The details are all there on our website about how to do so. I don't want anybody in Wales willing to come forward for vaccination ever to be left behind. So please, let's all continue to work together to keep each other safe and to keep Wales safe too. Diolch o galon I chi gyd. Turn now to take questions as usual from our colleagues in the media, and all the answers today will be broadcast on our own social media channels. And the first person for a question today is over to Teleri Glyn Jones at BBC Wales.
Pnawn da, Prif Weinidog, diolch yn fawr iawn. If we could have the answers to both questions in Welsh too, we'd be very grateful. Diolch yn fawr iawn. Can you give us some more information about the number of the 97 people who've been confirmed to have this Delta variant? Are they vaccinated? Have they had 1 or 2 doses? How many are hospitalised? You said you're confident that the local public health teams have it under control. So are we talking about community transmission in those areas, well, particularly in Conwy?
Diolch yn fawr, Teleri. So, of the 97 people, the considerable majority are people who have not been vaccinated, but there are some examples of people who have the new variant who have had vaccination in the past. There's no evidence in Wales so far of more than you would expect of that 97 people needing hospital treatment. Most of the clusters of the new variant are close-knit clusters where local public health teams are well on top of. Their contacts have traced them and know what people are doing. The Conwy cluster is the largest cluster. We have had examples there of people contracting the virus in schools and in workplaces. There are up to 300 people self-isolating as a result. But we don't have definitive evidence that it is now at a community spread level. And the local public health team is working very hard indeed to make sure that all the individual cases in that cluster, all their contacts are known about, and we're dealing with it by those well-known and well-experienced public health measures. The spread of the virus across our border does mean that we cannot imagine that we will be exempt from further rises in the new variant here in Wales, or indeed the possibility that it may supplant the Kent variant as the dominant variant even at community level. So ar hyn o bryd, mas o'r 97 o bobl, mae y rhan fwyaf ohonyn nhw wedi cael ei frechu'n barod. Mae rai nifer fach sy'n dioddau o'r amrywiolyn Delta ddim wedi cael ei brechu yn barod. So, rhan fwyaf ddim wedi cael ei brechu, nifer fach o bobl sydd yn wedi cael y brechlyn. Ni'n gwybod pwy ydyn nhw. Mae'r tîmau lleol yn gweithio'n galed i mynd ar ôl pob un a pob un yn y cluster ble mae bobl wedi cwrdd gyda bobl eraill. Lan yn y gogledd, yn Conwy, mae'r cluster y fwyaf da ni. Ni wedi weld achosion yn y gweithlu yn ysgolion, a mae 300 o bobl yn hunan ynysu nawr ar ôl wedi bod mewn cysylltiad gyda unrhyw person sy'n yn ddioddau o'r amrywiolyn newydd. Ond mae'r pobl lleol yn gweithio galed I bod ar ben top popeth sy'n digwydd yn Conwy hefyd. Ar hyn o bryd, does dim tystiolaeth da ni I ddangos mai fwy o bobl yn ein ysbytau ni ar ôl yr amrywiolyn Delta nag oeddwn ni'n disgwyl. Ond, pan ni'n weld y nifer o bobl sy'n dioddau o'r amrywiolyn newydd dros y ffin yn cynyddu bob wythnos, bydd rhaid I ni wynebu y ffaith, bydd hwnna yn mynd I cael effaith arno ni yma yng Nghymru, a dyna pam ni'n paratoi am hynny trwy trial I roi y frechlyn i'r pob un ohono ni yng Nghymru mewn ar amser mor gyflym sy'n bosibl.
Diolch yn fawr iawn. So, Wales has the lowest rates of infection across the UK, the lowest cases of the Delta variant. It doesn't seem to be transmitting in the community. It hasn't obviously led to any hospital admissions. We haven't had any deaths in 9 days, and the vaccination programme continues apace. With all that in mind, how can you justify keeping us under, prolonging our lives under restrictions?
Well, you're absolutely right that if you took a snapshot of the position in Wales today, you'd think that we were in a very positive position indeed. And that is why we are able to move into alert level 1 and why the Cabinet's decision is that if things continue that way, we'll be in level 1 completely within this 3-week cycle. But the reason why it is not sensible to move wholesale into alert level 1 on Monday of next week is because of our concerns about that new variant. And while at the moment it may not be here in Wales in large numbers or spreading at a community level, that is already the position in both England and Scotland. And to just take the risk that we would not see that happen here in Wales is a risk that I think it would not be sensible to take. So the advice from our chief scientific officers and our chief medical officer was that a pause of 2 weeks for us to get further and better evidence of the impact of the Delta variant in Wales and to carry out nearly 300,000 more vaccines in Wales will give us a stronger position in the final week of this 3-week cycle to move ahead with further easements. 2 weeks, I know it'll be disappointing for some people, but it's a genuine investment in making sure that everything we've achieved together isn't put at risk. So, ar hyn o bryd, jyst yn edrych am y sefyllfa yma yng Nghymru, wrth gwrs ni'n gallu weld mae lot o pethau positif da ni fel oedd Teleri Glyn Jones yn ddweud. A reswm pam ni ddim yn gwneud popeth I symud ni I gyd i'r lefel o'r bydd 1 mewn 1 cam ar dydd Llun nesaf yw yr amrywiolyn newydd, yr amrywiolyn Delta. A ni'n gallu weld yr amrywiolyn newydd yn Lledaenu yn gyflym, yn Lloegr ac yn yr Alban hefyd. A ni'n mynd I aros am pethefnos I cael fwy o tystiolaeth, I cael fwy o wybodaeth bendant am ar effaith yr amrywiolyn newydd yma yng Nghymru. Os mae pethau'n aros yn ei le ble maen nhw heddi, allwn ni symud ymlaen I ailagor mwy o digwyddiadau a gweithgareddau dan do cyn diwedd y trydydd wythnos o'r seicl presennol. Os mae y sefyllfa yn newid ac mae'r amrywiolyn newydd yn cael effaith arno ni, a ni'n gallu weld fwy o bobl yn cwmpo'n dos, fwy o bobl yn yr ysbytau ac yn y blaen, wel allwn ni cymryd hwnna I fewn i'r penderfyniadau sydd da ni I wneud. Be dwi ddim eisiau wneud yw creu fwy o risg yma yng Nghymru, risg sy'n rhoi popeth ni'n wedi wneud dy gilydd mewn perygl unwaith eto, a dyna pam ni'n mynd I wneud pethau yn y 3 wythnos nesaf mewn ffordd ni'n wedi wneud o blaen, cam wrth gam, mewn ffordd ofalus a bob tro yn cadw llygaid penodol ar iechyd y cyhoedd. Tereri, thank you very much indeed. Over to Owain Phillips at ITV Wales.
Pnawn da. Can I ask a bit more about the science of the relaxation outdoors versus indoors? Because I'm sure some people would struggle to understand how can you only have 30 at a wedding indoors, but 10,000 at a football match?
Well, the science is improving on this issue. So I received a presentation from our scientific advisors that drew together the evidence from right across the world over the last 15 months. And the ratio that they suggested to me, the science is now confirming, is that you are between 15 and 20 times more likely to catch coronavirus in an indoor setting than you are in an outdoor setting. So the distinction that we have made all the way through, saying that it is safer to do things outdoors than indoors, is very powerfully confirmed now by evidence from right across the world. So as far as weddings are concerned, of course, I understand and sympathise with those people who had hoped that more people could have met indoors in a regulated setting for weddings from Monday of this week. As from Monday, weddings with receptions outdoors will be covered by the 4,000 and the 10,000 thresholds that we have set out for outdoor gatherings. And if we are in a position in 2 weeks' time where the risks from the new variant are better understood and are not affecting us here in Wales, then it's still our ambition and our intention to raise the number of people who can meet in indoor regulated settings, and that of course would apply to wedding venues as well.
And can I ask on social distancing? You've made it clear already you don't want to look at that on the 21st of June, as has been suggested in England. Can you give us a steer as to when that will be on the table? Are we looking at this summer, for example?
Well, I think that social distancing remains one of the strongest defences that we have against the risks that the virus continues to pose. And I've been very struck by the way in which, as I go around Wales, and I've been in many different parts of Wales in many different contexts, people continue to be very careful about the way they behave when other people are around. I see people moving off paths to let people go by. I see people making sure that they keep a proper, respectful distance from people. And, I'm not certain myself that there is a huge thirst for people to give up some of the safeguards that we're all able to contribute in the way that we behave in our own lives. And I think they will remain part of the repertoire here in Wales during the rest of the summer and maybe into the rest of this year. Whether we will be able to move from them being mandatory to just things that we advise people about and ask people to do in their own lives, well, I think that will depend upon whether we continue to see improvements in the position here in Wales. But as part of a personal repertoire of things that every one of us can do to keep ourselves and others safe, I think it will remain part of people's response to this public health crisis for as long as coronavirus persists. Owain, diolch yn fawr. Draw I Branwen Jones at S4C.
Diolch, a prynhawn da, Prif Weinidog. Gyda chlwstwr o amrywiolyn Delta yng Nghonwy a rhai achosion mewn ardaloedd fel Porthmadog, ydych chi'n bwriadu ystyried cyfyngiadau clo lleol os yw'r sefyllfa'n gweithygu?
Wel, ni byth wedi ddweud, ni wedi troi cefn ar wneud pethau lleol os mae hwnna a wneud synwyr o'r safbwynt iechyd y cyhoedd. Ar hyn o bryd, ydyn ni ddim yn y sefyllfa na yn y gogledd neu yn y dde hefyd. Ond, os mae'r sefyllfa yn ddatblygu ac y cyngor sy'n dod ato ni fel gweinidogion yn ddweud, a ffordd gorau I delio gyda'r sefyllfa yna yw I wneud fwy ac yn wneud yn lleol, wel, wrth cwrs, ni'n agor at y cyngor na. Branwen asking me whether we are considering local restrictions in those parts of Wales where we are seeing clusters of the new variant. And I was simply explaining that local measures remain part of the potential actions we could take here in Wales. We don't think that the current circumstances require them. But if the advice from our public health professionals were to be that the most effective way of dealing with local outbreaks would be to take local measures, then we've certainly not closed our minds to that, and it remains part of the potential repertoire.
Diolch. Fydd hi'n 2 wythnos ers digwyddiad peilot y Llywodraeth yng Ngwyl Tafwyl yfory. Beth mae'r data yn ei ddangos o'r digwyddiad, ac oes mwy o gynlluniau i gynnal digwyddiadau cerddoriaeth Cymraeg?
Wel, diolch yn fawr. Y raglen pilot ni wedi gael dros Gymru wedi bod un llwyddiannus yn fy marn i, achos ni wedi dysgu lot o pethau sut i redeg digwyddiadau mewn ffordd sydd yn gwarchod iechyd y bobl sy'n troi lan i bod rhan o'r digwyddiad. Ac yn y pilot sy'n wedi weld ar hyn o bryd, does dim tystiolaeth dwi wedi weld sy'n ddweud mae pobl wedi cwmpo'n dost ar ôl bod yn y digwyddiadau, ond mae hwnna wedi digwydd achos yn y pilots mae pobl wedi cymryd y mesur sy'n angenreidiol i redeg digwyddiadau ac gweithgareddau mewn ffordd sydd yn ddiogel. Dyna pam ni'n barod nawr i symud cam ymlaen i cael fwy o digwyddiadau a gweithgareddau yn yr awyr agored, achos ni wedi dysgu y wersi o'r taffwyl a nifer o pilots eraill. Ond pan dwi'n ddweud, bydd y rhaid i bob digwyddiad cael asesiad o'r risg ac roi pethau yn ei le sy'n effeithiol i warchod pobl. Ni wedi dysgu hwnna achos ni wedi cael a raglen o pilot sy'n wedi bod yn llwyddiannus ac wedi helpu ni i paratoi am y dyfodol. Bramwyn was asking me about the pilot programme we've had and what we've learnt from it and how it will help us to have more events of that sort in the future. And I was saying that I think the pilot programme in Wales has been very successful, that we have learnt lots of things from it. Branwen asked me if we had any evidence of people falling ill as a result of attending those pilots, and I've not seen any of that. But I think that's because the people running the pilots have taken all the necessary measures to keep people safe when they turn up to attend them. And it's partly because of the lessons we've learnt that we're in a position to move forward and to allow greater numbers of people in future to attend events that are held in the open air, remembering that each event will have to have a risk assessment to make sure that the sort of effective measures that we've learnt through the pilot programme can then be applied to the wider range of events that will now be possible in Wales. Branwen, diolch yn fawr. Draw i Adam Hale, PA.
Prif Weinidog, you suggested this morning that getting rid of restrictions could be dependent on people taking up the first vaccination dose. What percentage of the population do you think that will need to be, or do you know what percentage that will need to be at the moment? Because not everyone is going to take up the dose, obviously, so is there a certain threshold that needs to be met?
Well, Adam, thank you. I hope to have more to say on Monday about the future of the vaccination programme. The good news in Wales is that despite some anxieties that we've had about whether there would be vaccine hesitation or people, anxious about coming forward, actually the figures in Wales, the figures published at 12 noon today, I think are remarkably strong. 98% of care home residents, over 90% of people in their 80s, in their 70s, in their 60s have now taken up vaccination, even amongst the younger age ranges where we continue to be inviting people to come forward for vaccination. the figures are very strong. And if I can put my hands on the right piece of paper, I can even give you the figures for those as well. So people in their 40s, 82% of people have come forward already for a first dose, 70% of people over 30, and 59% of people aged between 18 and 29 already vaccinated here in Wales. So rather than setting thresholds, what I want to do is to go on encouraging people in Wales to come forward voluntarily. And I think the evidence so far is that because of the strength and the success of our vaccination programme, we are succeeding in getting people coming through the door in those very, very healthy numbers.
There's some confusion about whether or not DJs are classed as live performers under the latest rules for live performances in hospitality venues. Can you clarify whether DJs are able to work under the current rules? And if not, what's the justification for that, considering they are able to go and earn money just over the border in England?
I don't want to offer you a definitive answer without being absolutely sure that I know it myself. If I was having to answer it, I would say that DJs are covered by the current rules in Wales and will be allowed to operate. But we will be providing the normal detailed guidance alongside the changes that we've announced today, and I'll make sure that that point is specifically covered for anybody who needs to make sure they know what is and was not allowed here in Wales. Adam, diolch yn fawr. Next to Dan Bevan at LBC.
Thank you, First Minister. Good afternoon. The MHRA have said this morning that they've approved the Pfizer-BioNTech vaccine for 12 to 15-year-olds. Of course, it's now down to the JCVI to do the same, but you previously said that you would roll the jab out to children if it was approved by both those bodies. What is your strategy for that? Will it be rolled out in schools, or will children have to go to mass vaccine centres? And how long of a time frame do you think that it would take to vaccinate people in that age group?
Dan, thank you very much, and it's very good news today that we got MHRA approval for the first vaccine for children of secondary school age. You're absolutely right. It's not the end of the journey, because now the JCVI has to consider that, and we will follow the JCVI's advice as we have throughout. If the JCVI does recommend that we go ahead and vaccinate young people of that age group, then we have already been in conversations with the sector about the best way that we can do that. A little bit does depend on timing, how quickly we get that advice, whether there's anything that can be done in the remaining part of this summer term, or whether we end up carrying out vaccinations when children return to school in the autumn. If it is the autumn, then we already have a programme of vaccinating young people against seasonal flu in our schools, and we will look to see whether it is possible to get some synergies between the vaccine for coronavirus and the vaccination programs we would normally be running, so we can get those young people vaccinated as quickly and effectively as we can. But we're not at the point of being able to confirm all of that today, because that will to an extent depend upon the advice that the JCVI provides to us and when that advice becomes available.
Thank you. And with the Euros just around a week away, and you encouraging fans to not to travel abroad to watch the team play, it opens up the prospect of fan zones being potentially vital to people being able to watch the games in larger groups, but it being safer to do so outdoors, of course. So tell me, from the conversations we've had with local authorities, they think that, to use a sporting analogy, it's very much still in your court whether these are allowed or not. So is this something that you have considered or are planning to consider with the tournament so close to being started?
Well, provided it is practical in the time that is available, then the rules that will come into place on Monday will allow fan zones to be organised, provided that they are a properly organised event and that the risk assessment is carried out depending on the size of the venue, the nature of the venue, the number of people who will be there to staff it and so on. That will draw, as I said in my answer to Branwen earlier, on the learning from the pilot programmes. But as from Monday, organised events outdoors will be possible on the scale that we've set out, and that would include fan zones. There's not much time to go, and given that these would have to be properly organised, then we'll have to see what is possible in the time available. But if it is practically possible, provided the risk assessments can be carried out, then yes, today's decision does open the door to that sort of activity. Dan, thank you very much. To Mark Hutchins at 5 Live.
Thank you, First Minister. We are seeing a toughening up of restrictions on travel abroad. At the same time, people are able to holiday around the UK, and right now there'll be people from the north of England holidaying in Wales and vice versa. Could you and should you have done more to head off what might seem like an inevitable spike in cases following a sunny half-term?
Well, it's a bit of a complicated answer, Mark, so I'll try and simplify. First of all, the advice from the UK government to people in English hotspots is that people should not travel in or out of them. And I endorse that advice. But it is only advice, and that means some people will travel. And where they do, then what we're asking people coming from those hotspot areas is to carry out all the additional safeguards that they will be very used to because they will be in operation in those communities already. So that, for example, is lateral flow tests that people can take themselves. They can pick up the tests freely. It makes it more apparent to them whether or not they themselves are at risk of falling ill. And we've been asking people coming from those parts of England into Wales to make sure they bring those tests with them. We can supply them to them if that's not possible. But it's just asking them to act as responsibly in Wales as they would if they were still at home. Could we have prevented people from travelling into Wales from those places? Well, in a practical world, we don't think that we could. Every day, even when the border was closed, when the second wave was at its height, thousands of people crossed the border every day because you were allowed to travel for work. You were allowed to travel if you were a child who lived in England but was in school in Wales, or lived in Wales and went to college in England. You were allowed to travel for medical treatment, and every day thousands of people came back and forth. So even if we said we're going to close the border, that would not eliminate the risk of the virus spreading in that way. And when you are talking about travel from hotspots rather than the whole of England, then it's almost impossible to imagine how a police officer would be able to spot from a car coming across the border whether they were travelling from a hotspot in Bolton or a part of England where there's very little of the new variant in circulation. So even if we'd done it, it was very difficult indeed to see how it could be practically enforced. For all of those reasons, we've decided, and more, we've decided not to do it because it wouldn't have offered an effective protection.
You have given the go-ahead for mass participation events like, for instance, Park Run to resume. Clearly, there are lots of hurdles still to clear, though not literally. How soon do you think events like that can resume? Do you have worries about people travelling from other areas to take part?
Well, I know that there will be many people who are responsible for those sorts of events who will have been planning ahead and will have been thinking already about what they need to do in order to get those risk assessments carried out and to resume those activities safely. I don't think it will be long before we see the start of outdoor events in Wales, and I think that number will increase week by week as people get more used to it and get to become familiar with what is required in order to hold such an event safely with the larger numbers involved. We're in a very benign position in Wales at the moment. and travel from one part of Wales to another is not, I think, likely to add materially to the risks that we are facing. But part of the reason why we have paused for 2 weeks any further relaxations beyond the things that will happen on Monday is to allow us to get more definitive sense of the risks that the new Delta variant will pose. And, you know, we will take whatever action is necessary if it turns out that it is more sensible for people not to be taking the risk of moving around the country and taking that variant with them. We don't expect to be in that position, but 2 weeks more information and advice from SAGE on the one hand and our own advisors on the other will give us a more definitive sense of what is and what is not sensible from a public health perspective. Mark, thank you. To Mark Smith at Wales Online.
Thank you very much indeed, First Minister. Do you know how long the whole process takes for Public Health Wales to identify a positive test result as one of the variants? And does that have an impact then on how quickly you're able to get public health teams involved to react then to the situation?
Well, Mark, we have one of the best capacities anywhere in the world for genomic sequencing. And that's what we rely on to identify whether or not someone is suffering from the sort of Kent version of the virus or the new version of the virus. And, you know, the UK has some of the best capacity in the world, and we have some of the best capacity in the United Kingdom. So the speed with which we are able to identify these cases, it's not as straightforward as just going and having a test result, but it is as good as you're likely to find anywhere. And as soon as we know that we have a case, then our public health system is now very fast in contacting those people through the TTP system. You know, we have 95% contact rates of the index case, 95% rate of contact of their contacts, and we're doing it within 24 and 48 hours of the TTP system being alerted to that case. So, you know, I'm not able to say to people that we get every case as quickly as we would like, because the sequencing process does take a bit of time. But our system is as good as it is possible to get in the current state of science and practical services on the ground.
Thank you very much indeed. And secondly, as you mentioned earlier, Wales now has by some distance the lowest COVID infection rate in the UK. Why do you think we're seeing such, I guess, a divergence between us and particularly England at the moment? And given, I guess, what we've seen over the last year, is it a mistake to read too much into that at this moment in time?
Yeah, I wouldn't read too much into it, because if the Delta variant does come across the border and becomes the dominant strain here in Wales, we will undoubtedly see our numbers go up as well. I do think, though, that the figures are a partial reflection of the different approaches that we have taken. The fact that in Wales we have taken a cautious step-by-step approach to opening things up, that we haven't opened things up on a sort of big bang basis where you have one day every 5 weeks where you do an awful lot of reopening. The advice we've always had is that it's better to do it in stages so that you can assess the impact of the changes that you've made. I think all of that has helped to keep the numbers low in Wales, as well as the huge efforts that individuals make in their own lives. And it's not the whole of the explanation of why we've got our figures and others have higher figures, but I do think it is part of that explanation. Mark, thank you. Over to Steve Bagnall at the Daily Post.
Thank you, First Minister. Is there any further information on how the Delta variant cluster of cases emerged in Llandudno? Are you able to clarify if it is thought to be cross-border or international travel that may have brought it about?
Without my notes in front of me, I'm relying on what I read, but I believe it's an international travel origin to that cluster, as almost all clusters in Wales have been. It's almost all people who have been abroad, and when they come back to this country, they find that they are already infected. And I think that's the origin of the Conwy cluster, and as I say, that is very characteristic of other clusters in other parts of Wales.
Thank you for clarifying that. You have mentioned holidays. With the situation around summer holidays abroad uncertain, and a possible increased influx of visitors to North Wales and the rest of Wales as a result, as people take staycations, is this a concern? It could spread the virus and variants here in the coming months. And can any additional measures be introduced to ensure people's safety?
Well, Steve, I can't say that it's something that we don't worry about, but I draw comfort from the experience we had last year, because this will be the second summer season where we've all had to be alert to coronavirus. And I remember very much that, last year, because we were opening things up later and there was understandable anxiety in holiday destinations in Wales who hadn't seen visitors for many months, at people coming back into those communities. But what we learnt was that the huge majority of visitors to those locations from within Wales or beyond were people who were scrupulous in the way that they themselves wanted to make a contribution to keeping those communities safe. So I think, the optimism that I have for this summer is that we've actually got less coronavirus than we had this time last year. We've got vaccination at huge levels in Wales, which we didn't have this time last year. We've got the whole experience of living with the virus for another 12 months. And provided people do act responsibly, think about how they keep themselves and others safe, then I think that we can have another successful season for an industry that has been very, very badly affected by coronavirus and is looking forward to having a successful summer season. Steve, thank you very much. Over to Rob Taylor at Wrexham.com.
Good afternoon. Early data published yesterday by Public Health England suggests that Delta is better combated with 2 doses, and with that set to be dominant, will there be any adjustments to make sure that vulnerable people are covered with double dose as soon as possible? And are there any plans to move forward second doses for everybody else? And if so or not, is there any supply to do that choice?
Rob, you are right that the second dose of the vaccine does offer you a higher protection against the new variant, but a first dose is very important as well. And it's particularly important amongst younger people. Some of the most difficult cases that they have seen across our border in English hotspots have been people in their 20s not vaccinated at all. Now, I hope on Monday to be able to set out a timetable for completing the offer of a first dose of the vaccine to all adults here in Wales, and also to set out a path for how we will get a second doses of vaccination. We've already got 45% of the Welsh population with both doses of the vaccine, and that's going up every day. When we've completed the first dose of all adults, we will be able to use all the capacity that we have for second doses, and that will accelerate second doses here as well. The supply is a rate limiting factor, of course. We use every drop of supply that we get to get it into people's arms as fast as possible. Local health boards already have flexibility to speed up second doses in areas where they think that would be a sensible part of the response to local clusters of the Delta variant. But the big picture will be when we're able to get first doses to everybody and then move on to complete second doses. And as I say, I hope to be able to set out more definitive timetables for that once we've seen the figures from today and over the weekend.
Thank you. And your opening remarks noted that the health service is very busy. Locally, we're hearing of such perhaps normal pressures with long waits for ambulances, long delays in emergency departments. Are you confident the NHS can cope with even a slight increase in COVID-related hospitalisations? as they appear under pressure now, even with the very low COVID figures around?
Yeah, well, look, that's a very good question. It's part of our caution here that the health service, as I said, it has gone from being flat out dealing with coronavirus to now being flat out dealing with everything else that it needs to deal with. And the headroom in the health service to deal with a significant rise in coronavirus cases is pretty limited and would result in further slowdowns of non-coronavirus work, just as the health service is trying to get back to dealing with some people whose treatment has already been delayed. So that calculation is very much in our minds and is part of the reason why we've decided to wait 2 weeks before reopening indoor activities at level 1. I think anybody listening would understand that the people working at the front line of our health service have had the most torrid time. They are exhausted in many ways, and we have to think very carefully about what we are able to expect of them in the future. Rob, thank you. Over draw I Twm Owen at the National.
Hiya, you said you were expecting the Delta variant to cross the border. So how many cases of the Delta variant would there have to be before you would reverse these latest unlocking measures that you've announced?
I don't think that will be the metric that we would use, Tom. It's not the raw number of cases. It is whether those cases mean that people fall so seriously ill that they need to be admitted to hospital and then create the sort of pressures in the system that we were just talking about with Rob. And that's a question we do not know the answer to as yet, but we will have far better information and insight into that in 2 weeks' time. So that, for me, is the crucial metric. It's whether or not vaccination means that increasing numbers of people suffering from the new variant leads to hospitalisation on the scale that we saw in earlier peaks, or whether vaccination manages to make a difference to that relationship.
Okay, and just on terms of vaccination then, obviously you've been asked about vaccinating children. Is there an obligation where if you can vaccinate the most at-risk children, you should share vaccines with developing countries?
Well, that's a really important question, and our Cabinet will talk about that very directly in the next week or so. It's not an issue, though, that I think is easily resolvable at the Welsh level. Say we were, and I suppose I think this is not likely, say we were to decide not to offer vaccination to children in Welsh schools, but they were being offered vaccination in England and in Scotland, the practical impact of our decision would not be to divert more supplies of vaccines to countries which don't have enough of it. It would simply mean we weren't drawing down so much of the UK stock, and that stock would be used elsewhere in the United Kingdom. So it's a genuinely important question, and I've followed very carefully what Gordon Brown, for example, has been saying about the UK's obligation to make sure that other parts of the world get their supply of vaccine, because none of us are safe until everybody is safe in this public health crisis. But whether unilateral action in Wales would make any genuine difference, I think is a much more complex question and one which the Cabinet will wrestle with. But I'm not convinced myself at the moment that not going ahead with vaccination in Wales would actually have an impact of diverting supply to elsewhere in the world. Diolch yn fawr. Tom, over to Thomas Moody at the Argus.
Good afternoon, First Minister. Can you tell us a little bit about the outcomes from your meeting yesterday with the other devolved nations in the UK government? And do you see this as, or do you hope that this will be a sign of working close together as you sort of pushed for throughout the whole pandemic?
Thanks, Tom. Well, look, it was a worthwhile meeting. I'm glad it happened. It was an opportunity for a fairly frank exchange of views on how we are going to be able to work together better in the future. My contribution was mostly focused on those border zone issues where the UK government has powers, where the Welsh government has powers, and where we need to put them to work together in order to make the biggest impact, particularly to help our economy to recover. The real proof of the meeting is whether it will lead to any practical changes, and in particular, whether it sets a new pattern of engagement for the future. If it is just a ad hoc, one-off meeting of the sort that we've become sadly used to, then it really will not have done the job that I would want it to do. If it does become the first in a reliable pattern of regular engagement, then I think that genuinely would offer us all an improved opportunity to share information, exchange views, and make better decisions. And I hope that that's what it will be, but I think we've just got to wait to see, given the history of the last 12 months.
Thank you. And I also wanted to ask about the Johnson & Johnson vaccine that was given the green light last week. Do you know roughly when we could see this first being rolled out in Wales? And given that it's only one dose, how will this impact how it is rolled out in Wales?
Well, thank you. Well, the Johnson & Johnson vaccine does indeed offer a one-dose solution to coronavirus and is therefore particularly useful for example, housebound populations where you need a very large organisation to be able to go visit, come back, visit a second time. So there are genuine possibilities that that vaccine offers. We are part of the UK government's effort to secure vaccine for the United Kingdom in the forward schedules of supply of vaccine coming to Wales, and we get them weeks in advance. I'm yet to see any supply identified from that source ready to come into Wales. So we continue to plan our programme on the basis of the Oxford AstraZeneca, the Pfizer and the Moderna vaccines. If and when Johnson & Johnson becomes available to us, it will offer us some important new possibilities. Thomas, thank you. Over to Jez Hemming at the Local Democracy Reporting Service.
Good afternoon, First Minister. I wanted to ask you about your meeting with Boris Johnson as well. And did you get a sense that the PM was being a tad more cautious in his approach? And what did he say about his plans to exit restrictions on June the 21st? And just for yourself, did you sort of feel that he was wrong in allowing holidaymakers to travel to Portugal?
Well, the Prime Minister was fully engaged in yesterday's discussions. I thought he was well briefed and that he made regular contributions to the discussion. We didn't talk about the decisions that are for the UK government to make largely in respect of England. So I'm afraid I've no real insights into whether or not the government for England intends to press ahead with lifting all restrictions on the 21st of June. I quite certainly myself, were I in that position and looking at the numbers from the Delta variant, I think I might be wanting to wait a bit longer to make sure I had the best possible information about its impact. On international travel, we have always urged a more cautious approach. We argued in the very beginning for an approach in which all countries in the rest of the world would be on the red list and you'd only be allowed to travel there by exception. I still think that would have offered us greater protections against the re-importation of the virus into Wales and the United Kingdom. Specifically on the decision overnight in relation to Portugal, though, I think that is the right decision, given the figures that the Joint Biosecurity Centre have reported about the prevalence of the virus in that country.
First Minister, I just want to ask you something specifically about the Delta variant. You said yourself there will be more cases. So with the news, the vaccines might not give us comprehensive coverage against that Delta variant as hoped. If it increases, will you be considering more stringent controls within an elderly social care environment, taking in mind what happened last year?
Well, the good news about people in those environments is that the level of vaccination, first and second doses, is over 90%, 98% of the first dose, and not very far off it in relation to the second dose as well. I think what we're learning about the Delta variant, but there is more to learn, Jez, definitely, is that while the level of protection from the first dose is reduced compared to its efficacy against existing variants, by the time you get to a second dose, then it's not very far off the level of protection that you'd get against the Kent variant. So at the moment, I think all the other measures that we are taking in relation to care home settings, the testing that we offer to workers there on a weekly basis, the regimes that care homes have put in place to make sure that they minimise the changes in the number of people coming in and out of them, they are being successful at the moment, and we need to make sure that we go on doing those things, and that where there still are people needing vaccination, that we get it to them in as timely a way as we can. And for the moment, I think we think that will be satisfactory, even against the Delta variant. But if we learn more, and there's more we need to do, then we would continue to do what we've done throughout, that is to follow the science and to take measures that we need to, even when those are difficult. Jez, thank you to Tom Magner at Carers World Live.
Thank you very much indeed, First Minister. Two coronavirus setting questions, if I may, looking ahead to Carers Week 2021. Firstly, during our Senate election leader interview series, we broadcast the film Family Carers Forgotten Lives. I don't know whether or not you had the chance to watch it. Would be interested to know if you did. But if you didn't, our film investigated the massive impact of the sudden, in some cases overnight, cutting of unpaid carer support services at the start of the first lockdown. Now, those services obviously need people to run them and money as well. So what's happened to the people and the money? Is it being kept back to restore services quickly? Or has the money already been spent elsewhere?
Well, Tom, I didn't get to see the film, I'm afraid, during the campaign. I don't think I saw anything very much other than people's front doors. What has happened to the money is that it is still there and is still being used by our local authority colleagues to do all the other things that they have needed to do during the pandemic. Far from money being taken away from local authorities, we have, and very willingly, found many millions of pounds extra to allow them to do the things that they've been able to do. And you're right, of course, in the very beginning, services were reduced at very short notice, but it was done for all the reasons that you will know, in order to minimise risk to people. But it doesn't mean that the money went anywhere else. It was just used in different ways to continue to provide services to those local populations.
Thank you for that. Some viewers think that the best way forward on unpaid carers is summed up in the question we'll be using for our Carers Week debate programme, and that is, should unpaid carers be treated as paid care workers? Be very interested in your reply. Thanks.
Well, I'm looking forward to Carers Week. I've been able to record some material for it myself, and there will be announcements next week by Julie Morgan as the Minister responsible, looking at how we are able to implement some of the manifesto commitments that we made. I think it's a debate, Tom, isn't it? I definitely meet some unpaid carers who absolutely would not wish to be paid for what they do. It would not fit in at all with what motivates them and the reason that they provide the care that they do. There will be other people who I know devote many hours to looking after somebody else in a way that has a very big impact on their lives as well, who may take a different view. But I think it's a very proper and useful debate to happen during Carers Week. And I'm sure you'll be back at another one of these events to tell me what was learned as a result of it. Thanks very much indeed.
Will. Thank you.
To Alan Evans at Llanelli Online.
Thank you, First Minister. Following Tom's questions, I'm sure you'll be happy with my next question. The First Minister has championed holidaying in Wales, and why not? If you can afford it, of course. A massive number of exhausted unpaid carers, a holiday in Wales is beyond their reach. 6 charities concerned with their plight are urging you to ensure unpaid carers get a break. What, if anything, can and will the Welsh Government do to support these people who are suffering poor mental and physical health as a result of caring for others around the clock and being able to afford a break?
Alan, diolch yn fawr. So our manifesto, the Labour manifesto at the election, made some specific commitments in relation to respite care and additional investment in it. And as I said to Tom, early next week, Julie Morgan will be making some announcements as to how we will take forward those commitments as part of Carers Week, and I'm sure that you and others will be looking out for the detail of that announcement.
Sticking with the theme of poverty, 1 in 3 or 200,000 children in Wales are in poverty, with 90,000 living in severe poverty. More than half of Welsh children in low-income families are worried about their parents are finding it harder to pay for everyday necessities such as food, heating and clothes. A quarter of parents living on low incomes in Wales report frequently skipping meals and feel they have nothing else left to cut back on. A fifth of Welsh parents on low incomes say stress about money affects their relationship with their children. Rising living costs, high unemployment, cuts in public spending, benefit changes and the impact of the coronavirus pandemic are all set to make the position worse in the years immediately ahead. You now have your term as First Minister to address this catastrophic legacy. What hope can the First Minister give to the poorest children of Wales?
Alan, thank you very much for that. I think child poverty across the United Kingdom remains a scandal in a country which is one of the richest countries on the face of the globe. And as I've said many times when I've been answering questions of this sort, the story during devolution very much is a story of 2 halves. The first decade of devolution with the Labour government in Westminster, we saw falls in child poverty across the United Kingdom, and some of the sharpest falls happened here in Wales. In the second decade of devolution, with austerity policies pursued at Westminster, we've seen those numbers go into reverse and rise again. I took the opportunity yesterday in the meeting with the Prime Minister, where the Chancellor of the Exchequer was also present, to press the UK government not to cut the £20 extra to universal credit that was introduced as part of the pandemic. There are many families in Wales where children rely on that £20 for the basic things that you identified in your question. Now, at the moment, the UK government provides no guarantee about that £20 beyond the end of September. And it's high time they gave those families the comfort and the confidence of knowing that they're not going to have to manage on even less money to deal with all the things that you spoke about in the question. And I also took the opportunity to say to the Chancellor of the Exchequer, who talked in the meeting about an investment-led recovery, that investment-led recovery has to be one that deals with the inequalities in the United Kingdom that were sharply exposed by the coronavirus experience. And it will not be a proper recovery if we don't build back fairer. We will wait to see whether those points were firmly understood by the Chancellor and by the Prime Minister, but I wanted to take that opportunity, a relatively rare opportunity, to make those points directly to them. Alan, diolch yn fawr. Over to Andrew Nuttall at the Leader.
Thank you, Minister. Here in Flintshire, we've had a successful pilot of one of the coronavirus vaccine drive-through projects. I believe from memory, there's over 250 people were given a vaccine in the space of about 6 hours, which is fairly impressive. Do you anticipate more things like this coming into force across Wales as the project was given the big thumbs up as a success? And if so, what kind of boost will this give to Wales' already leading vaccination rollout?
Well, thanks, Andrew. I myself had my vaccine at a drive-through centre in Cardiff, and it was a very impressive experience. You know, I think they said to me that they had a car through every 3 minutes on the system that they were working. You just, roll the car forward, stuck your arm out of the window, and you were on to the next thing. In fact, I did see myself a couple in the car in front of me where one person stuck their arm out of one window and one person stuck their arm out of the other window, and then they went on. So it's certainly an efficient way of providing vaccination, and the good news is that we've been able to learn from those experiences in Wales, and it's part of the repertoire, isn't it? And there are so many different ways we've learnt to be able to offer the programme of vaccination in Wales, from drive-in centres, from open access clinics to vaccinations in primary care and in pharmacies. And we go on learning from it, and it's part of the reason why we have the figures that we have in Wales, which show that we have the best vaccination rates, not just in the UK, but last week we had the best vaccination rates in the whole of the world.
Thank you. And moving on to a short distance in the future, are you worried about today's announcement giving some sort of mixed message in light of the variants that are cropping up as well here in North Wales, but more sort of freedoms to make the social choices of mixing and gathering with people in groups? Are you anticipating that these may bring delays to any further restrictions being eased?
Okay, well, look, it's always a balancing act when you're making these decisions. And this one was a particularly complex one, because the figures actually in Wales at this moment are, as we've heard earlier, the best in the United Kingdom. And if you just looked at them, you do ask yourself the question, why are we delaying any of these things? And the reason is, as you know, because of concerns at developments elsewhere. So yes, it's sometimes hard to explain to people the different factors that you are weighing up in making the decisions. I think we've come to the best conclusion that we can. Outdoor easements going ahead as from Monday, 2 weeks to get better information before, as we hope, we can move indoor events and activities forward as well, and we end up completing alert level 1 before the 3 weeks are up. But if we find in 2 weeks' time that the evidence about the Delta variant is more serious and that we have to pause things for longer, then if that's what we need to do for public health reasons, then that is what we will do. We hope not to have to do it. Our intention and our ambition is to complete the full move to alert level 1 before this 3-week cycle is up. Andrew, thank you. And finally, for today, to Elliot Worthing at That's TV South Wales.
Your First Minister, I'm Cynhadledd. The Unite for the Night campaign, which represents over 170 independent operators in Swansea and Cardiff, have warned that if England is allowed to open their clubs and venues on June the 21st and Wales isn't, the economic impact will be too great for them to reopen. Are you not concerned that the nightlife sector may not bounce back from the pandemic?
Well, it's important, as you'd say, the first thing is we don't know what's going to happen in England on the 21st of June. And the Prime Minister has said that they're delaying their decision-making about that in order to take account of the latest position about the Delta variant. So none of us know what the actual position in England will be. I am, of course, though, concerned about the nighttime economy and those people who work in it. And it's partly because we are having to delay some of the decisions we had hoped to make, that we are going to extend the window for those businesses to apply to the latest round of the Economic Resilience Fund. Applications were due to close on Monday of next week, the 7th. We're going to keep it open until the 14th of June to give those businesses more time to apply. And we are finalising a proposal to top up the current Economic Resilience Fund package for businesses who are specifically impacted by our inability to move ahead with the reopening of indoor activities over and above what is already available to them. So I know that's not the answer they would like. People would rather be trading. People would rather be open than having more help from the government. But in recognition of the fact that we're not able to move as quickly as we would like to lift indoor activity restrictions, we're going to, as I say, extend the timescale for making applications and add to the help that we're able to provide.
First Minister, and I know you touched this on earlier, but I was just wondering, how concerned are you about the spread of the Delta variant from northwest England into seaside resorts in Wales with summer approaching?
Well, we are concerned about it, of course. But as I say, we're facing it with some more confidence this year than we had last year. Confidence because coronavirus is at a much lower ebb at the start of June this year than was the position last year. Confidence because we have vaccination, which we didn't have at all last year, and a very successful vaccination programme in Wales. Confidence because of the experience we had last year, when we were able to welcome visitors from other parts of the United Kingdom back into Wales and found that those people acted very responsibly and wanted to make their contribution to keeping themselves, the others and the whole of Wales safe. So our message to people coming to Wales is, we welcome you back to Wales. We're glad we're able to have you here with us. Please help us to keep you, your family, and everybody else safe. There's lots you can do to help. We will be playing our part, and provided we work together, there'll be a successful summer season for the tourist industry in Wales, and one which everybody will be able to enjoy. Diolch yn fawr. Thank you very much. That's it for today.